Good morning, students. Today we will continue with our inclusive school paper. Today also we are going to discuss about another disorder which is prevailing among the young stage of the childhood. So it is called as autism. Autism, which means that these children, when you look at the autistic children, they are locked within themselves. That is, they can't have a free movement of body because it is going to be a neurological disorder. So it was first described by Leo Kanner in the year 1943. 1943, it is long back, so discovered very earlier itself. Leo Kanner described this in 1943, where he described this as an early infantile autism. Early infantile autism means because since this disorder is most prevalent during the young stage, that is the 3 to 6 years, it is more prevalent in that stage, and it was called as the early infantile. You know, infancy is 0 to 2 years, is it not? So early infantile autism. So this disorder is more prevalent during the first 3 years of a child's growth, and we can normally identify at that stage itself. It is going to be a neurological disorder. Okay, nammaloda nerves and brain cells disorder due to that. And then you can see what is the prevalence, how it is more common. It is found 2 to 6% out of 1,000 individuals are affected by autism. When you look into the case in India, 1 million people have been affected by this autism disorder. It is called as a autism spectrum disorder. Spectrum means what? It is a disorder where you have many types here. That is why it is called as a autism spectrum disorder. That is, which means they are locked within, and you can see that it is going to be a disorder which is prevalent in the children throughout their life. We can only provide some treatment. There is no cure for this disorder. And then coming to the next point, we will look into the causes. What is the cause? Why does the children have this disorder? Mainly due to the genetic disorder. What is genetic? From their parents they would have got this disorder. That is, they will have either a Fragile X syndrome, or the chromosome number 15 will be multiplied in number. It will be doubled in number in those autistic children. And there are some other reasons, like during the pregnancy, if the mother is going to have some viral infections also, the baby is going to be affected. When the pregnancy period, sometimes we have heard during pregnancy the mother will have anoxia condition, that is lack of oxygen during the birth. If the brain cells, whenever they are going to be affected, and sometimes we say that normally when young children are having fever, we should take care of them because fevers will damage their brain cells. If it is normal 1 or 2 days, it is okay. If it is going to prolong, we should consult the doctor and find out the health condition of the child. Okay. So viral infections during pregnancy causes the reason. Then there is no cure. We don't have any medicines for this, but by treatment, by giving them some medical diagnosis, by providing them some physiotherapy and others, we can make them to be enhancing their life, but there is no permanent treatment for this. Then look at the symptoms of autism. What are the symptoms? You can see that the autistic children will have a difficulty in their social interaction. What do you mean by social interaction? The way how any individual is interacting with the other person. So நம்ம மற்றவங்ககிட்ட எப்படி இன்ட்ராக்ட் பண்ணுறோம், பேசுகிறோம், பழகிறோம் அப்படிங்கிறது தான் சோஷியல் இன்ட்ராக்ஷன். யூ கேன் see that the autistic children, they can't just mingle with the other people very easily. They find it difficult. Take for example, if you ask an autistic child to wave a hand, they will not wave a hand by themselves. We have to make them shake their hands. And sometimes another common symptom in them is repetitive behavior. You would have seen some children, they will be always shaking their heads, shaking their hands. That is called as a repetitive behavior, repeated behaviors. And then obsessive interest. What is obsessive? That is, they will be wanting something for, they like something too much, or they want it always. Take for example, they would like some food item. Always they want that particular food item for all the day in the food meals, is it not? So that is going to be an obsessive interest. So what are the common symptoms? They have a difficulty in social interaction, difficulty in repetitive behavior, and difficulty in obsessive interest. Then coming to the types of autism. There are 5 types. Autistic disorder. You can find this autistic disorder where they have a difficulty in their social interaction, communications and language process. So it is more prevalent before the age of 3 itself. We can identify a child who is having. Take for example, at the age of 3 we expect any child to make to be little bit self-dependent, to talk some words fluently. Is it not? They find it difficulty. So through that we can find whether if the child is not able to move freely and all, we can find that the child is going to have an autistic disorder. And then the second one is Asperger's disorder. It is the disorder where you can see the child is going to have a difficulty in their language process mainly. They will have some difficulty in pronouncing the words, speaking with others, to react to others. Take for example, if I call out a name of a child of autistic, they will not be able to respond with, they will be looking somewhere, they will not be attentive in the class like that. And then the third one is pervasive developmental disorder. So what is pervasive? Pervasive means which is prolonging condition. So this is called as a typical autism disorder. So atypical autism disorder will be called as a pervasive developmental disorder. So development we have learnt in our paper CG, where we have various developments at different stages of life. If it is not going to happen, then it is called as a pervasive development disorder. Then the next one is Rett's disorder. What is Rett's? It is more prevalent among the girls in the age group of 1 to 4. Rather than male, the girl child is more affected by a Rett's disorder. Then the fifth one is childhood disintegrative disorder. Disintegrative, you know, something which is not coordinated. Okay, childhood la oru sila developments coordinated varlena, then it is called as a childhood disintegrative disorder. I hope now you are clear with what is autism. Normally, April 2nd of every year is celebrated as a World Awareness, Autism Awareness Day. April 2nd of every year is celebrated as Autism Awareness. Okay. So nowadays you can see, previously the government of India, they were celebrating particular day to spread an awareness among the public to reduce the impact of certain diseases. So April 2nd is called as the Autism Awareness Day. So are you clear with what is autism? Autism, which means the children who are locked within, they are locked because their neurological problems are there. They are not able to walk freely, move freely like other children. So locked within themselves. Then it is going to be a lifelong condition, and it was described by Leo Kanner in 1943. It reveals in the early childhood stages itself we can identify, and it's a neurological disorder, and it is 1,000 out of 1,000 people, 2 to 6 are individually affected, and the causes, genetic causes mainly, and also some viral infections. Symptoms when we consider difficulty in social interaction, repetitive behavior, obsessive interest, and when you look into the types of autism, there are 5 types. Are you clear now? Thank you.